Hello, my name is Kirsten, and I am here to discuss your meal plan for when you return home. Is this a good time to do that?
Yes, that's fine. I'm feeling a bit better today.
I'm glad of that. Can you tell me what happened yesterday?
Well, I started feeling sick the evening before coming to the hospital, but I thought nothing of it and just decided to eat light. By the next morning, it was worse and I couldn't stop vomiting. I felt so drowsy I couldn't do anything. I'm thankful that my coworker came to check on me or things would have been worse.
Your coworker really cares about you. She acted promptly, and bringing you to the ER was the best thing to do. The doctor diagnosed you with HHS, which is hyperglycemic hyperosmolar syndrome.
It's related to my diabetes and not taking my medication regularly.
Well, I believe that is one factor that may have affected your symptoms. Your blood glucose was high when you were admitted, very high. However, you were also dehydrated, which caused a mineral imbalance and some other serious problems that were seen in your lab work. Could you tell me what you know about treating your diabetes at home and the importance of taking your medication?
I know that my blood sugar gets high and I eat after the metformin helps to control my blood sugar. Glyburide is the same thing. If I don't take them, my sugar will stay high and I might pass out.
Is there any other information you would like to add?
I haven't been taking my medications when I'm supposed to because they make me feel sick.
Sounds like you know it's important to take your medications, but that you don't because how they make you feel when you take them. What would it take for you to take your medication regularly?
I know I'll be on insulin now, so I guess maybe that won't be such a problem.
The insulin may not have side effects like metformin, but you will have to follow a schedule to keep your glucose in check, your blood glucose in check. What would help you to take it regularly?
I've never seen anyone for diabetes teaching, so I've never known what to do when my schedule changes. As a contractor, my eating during the day changes and that makes it hard to remember to take my meds.
So having specific instructions will help your confidence level in taking your insulin or other diabetes medication on schedule? Actually, someone from the diabetes education team will come to see you. You can ask all your questions. It is important to be prepared for changes in schedules, like you said. The educator will also teach you how to deal with emergency situations.
That'll be great to get that information.
Now, we just talked about your medications and diabetes. What do you know about eating and controlling your blood sugar?
I know I need to stay away from sweets and other desserts. I watch my salt and try to stay away from high cholesterol foods. But that's more to help my blood pressure and cholesterol levels. In reality, I haven't thought too much about my diet and what I eat.
I see that you understand what you need to do to control your blood pressure and cholesterol levels, but you don't have too much information about meals. How would learning about healthy eating affect your control of blood glucose?
I guess I wouldn't have so many episodes of low glucose when I feel really bad or spikes in my glucose. It would be nice to feel normal.
Those are great benefits to having a healthy eating plan. It sounds like you really don't like the highs and lows that happen with unregulated blood glucose. I would like to discuss with you a meal plan that you would benefit from.
Okay.
First, I'd like to have an idea about your regular eating habits. I'd like you to read the descriptions of these 7 eating lifestyle patterns listed here and decide which one or two describes your usual eating habits.
I see myself as a meal skipper mostly. I don't eat on schedule and I don't really plan meals. Also, I hardly ever have vegetables or fruit at home. It's mostly salad.
Great. So you recognize your patterns of eating. We will use these to help guide your goals. What might help you eat more on a schedule?
I could use my planner to see that I schedule appointments more or less around a set lunch time.
Okay. And what about the morning meal?
I usually start with coffee. I have a bagel with cream cheese mid-morning and some more coffee.
Does that give you enough energy until lunchtime?
No, not really. The coffee just helps me to keep my hunger at bay. I know that's not good. A planned morning meal would help there also.
I see you are starting to see the benefits of having planned meals. You said that your morning meal is not enough to keep you full until lunch. Also, you suggested that you could adjust your work schedule a little to eat lunch at a more regular time. How do you feel about making that move to 3 meals a day?
I really think I can manage it. I was a disciplined person when I was active in the military. I can be disciplined again for the sake of my health.
Discipline is a character trait that will be very practical when making new changes. According to the information you shared with me, the 2 nutrition-related diagnoses I see are lack of self-monitoring of your diabetes, related to the lack of teaching in diabetes management, with the evidence shown in your described diet history and medical history. Also, I see a disordered eating pattern, not eating regularly, related to your lifestyle habits as evidenced by your usual diet. Would you agree with those?
Yes, those reflect what we just talked about.
How important is it for you to monitor your diabetes and change your eating pattern?
It's very important.
Mr. Fagan, as we start looking at the meal plan, I would like to suggest that you include some fruits and vegetables into your meal plans. As you mentioned, you don't often include them. This will help control your blood sugar and decrease chances of having any highs or lows.
If it helps manage my diabetes, then I'm willing to try.
Now, based on your current weight of 214 pounds and calculation, 214 pounds and your height of 5'9", your BMI is at 30.2. Then the calculation of your current total energy needs shows 2,300 calories. So I would suggest a 2,200 calorie plan. So the 2,200 calorie plan should give you enough calories each day. We can always adjust the calories if it isn't sufficient or when your activity level changes. Okay, here's the diet plan guide. This meal plan is based on the number of carbohydrate servings in each meal, because carbohydrates have the greatest effect of increasing glucose levels. Each meal will have the same number of carbohydrates. I would like you to log your carbohydrates in the guide as well. There is a log in there.
I see there's a meal plan with foods already chosen. Do I have to eat those foods?
Good question. No, this is just an example. Each meal will include 5 carbohydrate choices. The next pages include lists of carbohydrates and their weight in grams. Then you see it shows you if it is equal to 1 choice or 2 choices, etc.
Oh, I understand. So I choose carbohydrates from the list, and that will add up to 5 choices. But it's not always one food for one choice.
You got it. There's also a carbohydrate counting guide. So 15 grams of carbohydrate is equal to 1 serving. So you can also look at it as a total of about 75 grams of carbohydrate per meal.
In this example here, for example, the lunch meal, it totals about 75 grams of carbohydrates, or 5 choices.
It looks like you've got a basic understanding of the meal plan. I do want to add that your history of gout, you may want to limit foods that cause you to have worse symptoms.
Is there a list of those in this guide?
No, there isn't, but I can get you one to look over.
I hope.
What are your concerns about fitting this into your current lifestyle?
I hope I am able to create a meal plan that I will like.
So you want to make sure the meals taste good. That makes sense. We all want our food to taste good. We will work together to start with a plan with foods you like. I would first like you to look over the lists and see if you could put foods together that you would eat. Are you able to do that?
I can do that.
After the diabetes team meets with you, we can make sure you know your insulin doses to have with this meal plan and vice versa. I will make sure you are clear on everything before you go home. In summary, what do you see your goals are?
My goals are to follow the carbohydrate diet plan that you have given me by counting my carbohydrates, choosing foods I like to eat. I will also use the log. Then I will learn more about taking my medication now, insulin.
Great. Next week, we will look over your carbohydrate log and see how things have been going and get your feedback.
I'm glad it's in a week. Then if there are any more problems I can let you know.
Exactly. We will discuss any problems you are having and make changes if needed. Do you have any questions?
Not yet. I will look over the guide.
I will be back to finalize your diet plan. It was great meeting you. See you soon.
Okay, thank you.